Let me ask you a simple but powerful question. What if some of the biggest threats to your health weren't caused by bad luck or bad genes, but by habits you can change starting today? Every single day, I meet people who feel trapped. Trapped by high blood sugar, trapped by medications that keep increasing, trapped by fear of diabetes, heart attacks, strokes, and early decline. And most of them believe the same thing. This is just how it is now. But here's the truth I want you to hear clearly today. Your body is not broken. Your body is trying to heal. Diabetes doesn't happen overnight. Arteries don't clog in a week. Heart disease doesn't appear out of nowhere. These conditions develop slowly, quietly, over years of inflammation, sugar overload, and metabolic stress. And the good news, that means they can also improve step by step when you work with your biology instead of against it. Now, I want to be very clear. There is no magic food, no single seed, drink, or supplement that cures disease overnight. Anyone who tells you that is selling hope instead of truth. But there are simple, natural tools that support your body's natural ability to regulate blood sugar, reduce inflammation, and protect your heart. One of those tools, small, affordable, and incredibly powerful, is the chia seed. This tiny seed doesn't look impressive. It doesn't come in flashy packaging. It doesn't promise miracles. But when used correctly, consistently, and as part of a healthier lifestyle, chia seeds can play a meaningful role in improving blood sugar control, supporting artery health, and reducing strain on the heart. Today, I'm not here to scare you. I'm here to educate you. I'm here to empower you. And most importantly, I'm here to remind you that you are not powerless. By the end of this talk, you'll understand why blood sugar problems and heart disease are deeply connected, how simple fiber-rich foods like chia seeds support metabolic health, and how one easy daily recipe can help you move in the right direction. Starting today, this isn't about perfection. This is about progress, and progress starts with understanding. Let's talk about why this topic is so important. Diabetes and heart disease are not separate problems. They are two sides of the same metabolic coin. When blood sugar stays high for long periods, it damages blood vessels, increases inflammation, and accelerates plaque buildup in arteries. Over time, this leads to high blood pressure, blocked arteries, heart attacks, and strokes. High blood sugar also forces your pancreas to work overtime. Insulin levels rise, fat storage increases, energy crashes become normal, hunger feels constant, and slowly the body becomes resistant to the very hormone meant to protect it. This doesn't just affect your lab numbers, it affects your daily life. You feel tired even after sleeping, your weight becomes harder to control, brain fog creeps in, motivation drops, and fear about the future quietly grows. But here's the part that matters most. Most of this process is driven by diet and lifestyle, not destiny. Your body thrives on stable blood sugar, low inflammation, and proper nutrient intake. When you give it foods that slow sugar absorption, improve gut health, and reduce oxidative stress, you change the internal environment where disease develops. This is where chia seeds come in. Chia seeds are rich in soluble fiber, omega-3 fatty acids, and plant compounds that help slow glucose absorption into the bloodstream, improve insulin sensitivity, reduce inflammation in blood vessels, support healthy cholesterol balance, promote fullness and appetite control. No, they don't destroy diabetes by themselves, but they support the conditions where diabetes struggles to survive. And when you combine that with consistency, movement, sleep, and reduced sugar intake, that's when real change happens. The real problem we need to talk about is not just diabetes and it's not just heart disease. The deeper issue is what's happening silently inside your body every single day, often without obvious symptoms at first. It's the constant rise and fall of blood sugar driven by modern eating habits that your biology was never designed to handle. When you eat foods high in refined carbohydrates and sugars, bread, sweets, sugary drinks, processed snacks, your blood glucose rises rapidly. Your body responds by releasing insulin, a hormone meant to move that sugar out of the blood and into cells. In the short term, this is normal, but when it happens all day, every day, the system becomes overloaded. Over time, your cells stop responding properly to insulin. This is called insulin resistance, and it's the foundation of type 2 diabetes. Your pancreas is forced to work harder and harder, pumping out more insulin just to keep blood sugar under control. Eventually, it can't keep up. Blood sugar stays high, insulin stays high, and inflammation becomes chronic. This is when damage begins, not suddenly, but quietly. High blood sugar doesn't just float harmlessly in the bloodstream, it sticks to proteins, damages the lining of your blood vessels, and creates oxidative stress. Your arteries, which are meant to be flexible and smooth, start to become stiff and irritated. Cholesterol particles are more likely to get trapped in these damaged areas, forming plaques. This is how clogged arteries develop, not because your body failed you, but because it was under constant metabolic stress. In daily life, this process shows up in ways many people ignore or normalize. You feel tired after meals, you crave sugar even when you're not truly hungry. Your weight slowly increases, especially around the abdomen, your focus drops, your mood fluctuates, and energy feels unpredictable. These are not signs of aging or weakness, these are warning signals that your metabolism is struggling. Long term, the consequences are serious. Persistent insulin resistance increases the risk of heart attacks, strokes, kidney disease, nerve damage, vision problems, and cognitive decline. But what's important to understand is that none of this happens overnight. It develops over years of repeated blood sugar spikes and inflammation. And that means it can be slowed, stopped, and in many cases reversed when you change the environment inside your body. This is why blaming genetics or assuming it's too late is so damaging. Your genes load the gun, but lifestyle pulls the trigger. Your body is constantly adapting to the signals you give it through food, movement, sleep, and stress. When those signals improve, your biology responds. The problem was never a lack of willpower. The problem was a system under pressure, doing its best to survive in an environment it was never designed for. Now let's talk about solutions, because understanding the problem only matters if it leads to action. The goal is not to fight your body, punish it, or starve it into compliance. The goal is to support it, to give it the conditions it needs to stabilize blood sugar, reduce inflammation, and restore metabolic balance. This is where simple, natural tools used consistently can make a real difference, and chia seeds are a powerful example of that approach. Chia seeds work not because they are magical, but because they change how your body processes food. When chia seeds come into contact with liquid, they absorb many times their weight in water and form a gel-like substance. Inside your digestive system, this gel slows the breakdown and absorption of carbohydrates. Instead of sugar rushing into your bloodstream all at once, it enters gradually. This means smaller blood sugar spikes, lower insulin release, and less stress on your pancreas. Over time, this supports improved insulin sensitivity, which is exactly what the body needs when dealing with diabetes and metabolic dysfunction. This effect also has a powerful impact on appetite. Rapid blood sugar spikes are often followed by crashes, and those crashes trigger hunger, cravings, and overeating. By slowing digestion, chia seeds help you feel full longer and more satisfied after meals. This naturally reduces snacking and excessive calorie intake without forcing restriction. When people say they feel more in control of their eating, this is often what's happening biologically. A simple way to use chia seeds is to soak 1 tablespoon in a glass of water, unsweetened almond milk, or plain yogurt. Let it sit for at least 20 to 30 minutes or overnight if possible. Consuming this before your largest meal of the day can help blunt the blood sugar response to that meal. Adding a small amount of cinnamon or lemon can enhance flavor and may provide additional metabolic benefits, but the key is consistency, not complexity. It's important to understand that chia seeds work best as part of a supportive lifestyle. Pairing them with whole, unprocessed foods, vegetables, quality protein, healthy fats, creates a stable metabolic environment. Gentle movement, such as a short walk after meals, helps muscles absorb glucose without requiring large amounts of insulin. Adequate sleep allows hormones that regulate hunger and blood sugar to reset. These small habits work together, reinforcing each other in ways that medication alone cannot. What matters most is repetition. One healthy choice won't undo years of metabolic stress, but repeated healthy choices absolutely can. The body responds to patterns, not perfection. When you consistently slow sugar absorption, reduce inflammation, and support gut health, your internal chemistry begins to change. Energy improves, cravings fade, blood sugar becomes more stable, and the fear that once felt overwhelming starts to loosen its grip. This is how real change happens, not through extremes, but through simple actions done daily with patience and trust in your body's ability to heal when given the right support. Your body wants to heal, your metabolism wants balance, and your heart wants relief. You don't need perfection. You need understanding, patience, and consistency. Start small. Start today. Give your body the tools it's been asking for. 1C, hoist, 1 habit, 1 step forward. Your future health is built on what you do next.